So today in Active Learning Medicos, we are going to learn about vitamin K relevant to pharmacology. So the important points are: it's a fat soluble vitamin, it's required for clotting factors 2, 7, 9 and 10 synthesis. So forms of vitamin K include vitamin K1, also known as phytonadione, source is plant and animals. Vitamin K2 is menaquinone. Its source is very important, it's from intestinal bacteria. And vitamin K3, which is menadione, which is synthetic in source. So the dietary sources of vitamin K mainly include plant, which includes spinach, cabbage, cauliflower, tomato and pear, and animal sources like butter, meat, milk and liver. The very important point here to be remembered is the average dietary intake of an adult, which is 70 to 140 microgram per day. This is very important. So let's come to the pharmacokinetics. The pharmacokinetics is very easy. Absorption, K1 and K3 require bile for absorption because they are fat soluble, transported along with the LDL. Storage is in liver, excretion in bile and urine. Okay, so let's come to this very important flow chart, the role of vitamin K in clotting. So let's start with vitamin K epoxide. This compound is the inactive form of vitamin K. Now this is converted to the active vitamin K by epoxide reductase enzyme. Now as a side point, remember that warfarin inhibits this epoxide reductase. Nevertheless, this active vitamin K again is converted into vitamin K epoxide by the enzyme carboxylase. The carboxylase enzyme does another thing. Vitamin K gets inhibited or inactivated, and the decarboxy factors, clotting factors, which are actually non-functional, they get into functional, the coagulation factors like factors 2, 7, 9 and 10. So basically, to summarize, the action of vitamin K is as a cofactor in the conversion of the gamma carboxylation of inactivated clotting factors 2, 7, 9 and 10, which ultimately helps in calcium and membrane phospholipid binding, which cause the coagulation. Also, another action of vitamin K is in bone development along with the help of the osteocalcin protein. It's a protein which helps in the development of the bone. Okay, so let's come to the deficiency of vitamin K. This is again very important. So deficiency can either have three causes, like inadequate absorption due to the lack of bile salts, loss of vitamin due to chronic diarrhea, and chronic use of broad spectrum antibiotics. Since we have seen that bacterial flora is also required for vitamin K production, so bacterial flora suppression can cause deficiency symptoms of vitamin K. Now the effect will be that increased tendency to bleed, right? Can either be epistaxis, hematuria, GI bleeding or post-op bleeding. Okay, let's come to the adverse effect of vitamin K. Yes, there are some. Oral vitamin K is safe, but IV injection may cause flushing, sweating, dyspnea, cyanosis, collapse or anaphylactic reaction. Also, vitamin K3 may cause hemolysis and hyperbilirubinemia and kernicterus of the newborn. So these are very, very important. Let's come to the next preparations of vitamin K. One is phytonadione, which we saw that it's a vitamin K1 form. So it is available in oral, subcutaneous, intramuscular and intravenous. And the next form of vitamin K is menadione sodium diphosphate, which is vitamin K3. Menadione vitamin K3 is fat soluble, but the salt form is water soluble. So basically we notice that same thing here. So water soluble salt, it is available in oral, intramuscular and intravenous. Menadione sodium diphosphate is not usually used because of its low efficacy and toxicity. So phytonadione vitamin K1 is mainly used. And the final uses of vitamin K. So vitamin K is used to prevent and treat bleeding associated with vitamin K deficiency. So these are the conditions and this is the treatment. So on the left we observe obstructive jaundice plus bleeding. We use parenteral vitamin K as treatment. Prolonged antimicrobial therapy induced vitamin K deficiency. We use parenteral vitamin K. Neonate routine vitamin K1 is given to prevent bleeding since the intestinal flora has still not developed. So 1 mg phytonadione intramuscular is prescribed. Control bleeding due to oral anticoagulant. The same phytonadione is used, and salicylate poisoning, which is also known as aspirin, plus hemorrhage if it's seen, then vitamin K is also very useful. So that was everything about vitamin K. Subscribe now and keep yourself notified so that you don't miss any upcoming lessons. Keep actively learning.